Welcome to Anaga Health. Today we are discussed about occupational health, equitable workplaces, championing diversity and inclusion. Description: join us on a journey to explore the importance of diversity and inclusion in the workplace. In this video, we'll delve into the challenges faced by underserved populations, the benefits of fostering diverse environments, and practical strategies for creating equitable workplaces. From understanding systemic barriers to advocating for positive change, students will gain valuable insights into promoting inclusivity in their future careers. Let's work together to build a more just and equitable society for all. First topic: understanding occupational health. Introduction. Occupational health plays a crucial role in ensuring the well-being and safety of individuals in the workplace. For students entering the workforce or pursuing careers in various fields, understanding occupational health principles is essential. In this comprehensive guide, we will explore the fundamentals of occupational health, including its importance, key concepts, and practical applications. 1. What is occupational health? Definition: occupational health refers to the promotion and maintenance of the physical, mental, and social well-being of workers in all occupations. Importance: ensures a safe and healthy work environment, enhances productivity, reduces accidents and injuries, and promotes overall employee well-being. 2. Key concepts in occupational health. A. Hazard identification and risk assessment. Identifying potential hazards in the workplace such as chemical exposures, ergonomic risks, and physical hazards. Assessing the level of risk associated with each hazard and implementing control measures to mitigate risks. B. Workplace safety. Importance of adhering to safety protocols and regulations. Understanding safety procedures, emergency preparedness, and the proper use of personal protective equipment, PPE. C. Occupational diseases and injuries. Common occupational illnesses and injuries, including musculoskeletal disorders, respiratory diseases, and occupational cancers. Strategies for prevention through proper ergonomics, hygiene practices, and health monitoring. D. Mental health in the workplace. Recognizing the importance of mental well-being at work. Addressing stress, burnout, and psychosocial risks through support systems and mental health initiatives. 3. Legal and regulatory framework. Overview of occupational health and safety laws and regulations at national and international levels. Understanding employer and employee responsibilities in maintaining a safe work environment. 4. Promoting occupational health in education. Integration of occupational health education into school curricula. Importance of raising awareness among students about workplace hazards and preventive measures. Utilizing educational resources such as videos, workshops, and online courses to disseminate information. 5. Career opportunities in occupational health. Exploring career paths in occupational health and safety management, industrial hygiene, ergonomics, and occupational medicine. Educational requirements, certifications, and professional development opportunities in the field. Conclusion: understanding occupational health is essential for students preparing to enter the workforce. By grasping key concepts such as hazard identification, workplace safety, and mental well-being, students can contribute to creating safer and healthier work environments. Incorporating occupational health education into school curricula and leveraging online platforms like YouTube can empower students with the knowledge and skills needed to promote occupational health throughout their careers. Title: Exploring Occupational Health Hazards. Second topic. Welcome to our YouTube guide on occupational health hazards. In this video, we'll delve into the various hazards present in the workplace and equip students with the knowledge needed to identify, assess, and mitigate these risks effectively. 1. Understanding occupational health hazards. Definition: occupational health hazards are factors in the work environment that have the potential to cause harm to employees' health and well-being. Types of hazards. A. Physical hazards includes noise, vibration, extreme temperatures, radiation, and ergonomic hazards. B. Chemical hazards, exposure to hazardous chemicals such as solvents, gases, and toxic substances. C. Biological hazards, risks associated with exposure to viruses, bacteria, fungi, and other microorganisms. D. Psychosocial hazards, stress, bullying, harassment, and other psychological factors impacting mental health in the workplace. 2. Identifying occupational health hazards. Observation, encouraging students to observe their surroundings and identify potential hazards in the workplace. Hazard identification tools, introducing tools such as risk assessment matrices, checklists, and safety data sheets, SDS, to identify and evaluate hazards. 3. Assessing risks. Risk assessment process, steps involved in assessing risks, including hazard identification, risk analysis, and risk evaluation. Risk control measures, strategies for controlling risks, such as engineering controls, administrative controls, and the use of personal protective equipment, PPE. 4. Mitigating hazards. Prevention strategies, implementing measures to eliminate or minimize hazards in the workplace. Training and education, importance of educating employees about hazards and proper safety procedures. 5. Real-life examples and case studies. Showcase real-life examples of occupational health hazards in different industries. Analyze case studies highlighting the consequences of inadequate hazard control measures and the importance of proactive risk management. 6. Resources for further learning. Provide links to relevant websites, articles, and educational resources for students interested in learning more about occupational health hazards. Encourage students to engage in additional training and certification programs to deepen their understanding of workplace safety. Conclusion: understanding occupational health hazards is crucial for students preparing to enter the workforce. By familiarizing themselves with different types of hazards, learning how to identify and assess risks, and implementing effective control measures, students can contribute to creating safer and healthier work environments. This video serves as a starting point for students to gain essential knowledge about occupational health hazards and take proactive steps to protect themselves and their future colleagues. Third topic: occupational diseases, a student's guide to workplace health. Introduction. Welcome to our educational YouTube video on occupational diseases. In this comprehensive guide, we'll explore what occupational diseases are, their causes, common types, prevention strategies, and the importance of workplace health for students entering the workforce. 1. Understanding occupational diseases. Definition: occupational diseases are health conditions that result from exposure to hazards in the workplace over an extended period. Differentiating between occupational diseases and injuries. Emphasizing the importance of early detection and prevention. 2. Causes and risk factors. Hazardous substances, exposure to chemicals, biological agents, dust, and fumes. Physical agents, radiation, noise, vibration, and ergonomic factors. Psychosocial factors, stress, bullying, harassment, and workplace violence. 3. Common types of occupational diseases. A. Respiratory diseases, asthma, chronic obstructive pulmonary disease, COPD, pneumoconiosis, for example, silicosis, asbestosis. B. Skin disorders, contact dermatitis, eczema, skin cancers, for example, caused by exposure to chemicals or sunlight. C. Musculoskeletal disorders, carpal tunnel syndrome, tendinitis, back injuries due to poor ergonomics. D. Occupational cancers, lung cancer, from exposure to asbestos, radon, or certain chemicals, skin cancer, from exposure to sunlight or carcinogens. E. Noise-induced hearing loss, resulting from prolonged exposure to high noise levels in the workplace. 4. Prevention and control measures. Engineering controls, redesigning work processes, ventilation systems, and machinery to minimize exposure to hazards. Administrative controls, implementing policies and procedures, providing training, and rotating tasks to reduce exposure. Personal protective equipment, PPE, proper selection and use of PPE such as gloves, masks, respirators, and hearing protection. Health monitoring, regular medical surveillance and screening for early detection of occupational diseases. 5. Legal and regulatory framework. Overview of occupational health and safety laws and regulations aimed at protecting workers from occupational diseases. Understanding employer and employee responsibilities in preventing occupational diseases and ensuring a safe work environment. 6. Resources for further learning. Links to reputable websites, articles, and organizations providing additional information on occupational diseases and workplace health. Encouragement for students to engage in further education and training to deepen their understanding of occupational health and safety. Conclusion. By understanding the causes, types, and prevention measures of occupational diseases, students can better protect themselves and their future colleagues in the workplace. This video serves as a valuable resource for students to gain essential knowledge about occupational diseases and emphasizes the importance of prioritizing workplace health and safety. Together, we can create healthier and safer work environments for everyone. Fourth topic. Mastering Occupational Ergonomics, a student's guide to workplace comfort and safety. Introduction. Welcome to our educational YouTube video on occupational ergonomics. In this comprehensive guide, we'll explore the principles of ergonomics, its importance in the workplace, common ergonomic risk factors, and practical tips for students to promote comfort and safety in their future careers. 1. Understanding occupational ergonomics. Definition. Occupational ergonomics focuses on designing workspaces, tasks, tools, and equipment to fit the capabilities and limitations of workers, thereby enhancing comfort, productivity, and safety. Importance. Prevents musculoskeletal disorders, reduces fatigue and discomfort, improves efficiency, and enhances overall well-being. 2. Ergonomic risk factors. A. Repetitive tasks, performing the same movements repeatedly, leading to strain and overuse injuries. B. Awkward postures, working in uncomfortable positions, such as bending, twisting, or reaching, which can strain muscles and joints. C. Forceful exertions, using excessive force or exerting high levels of effort during tasks, increasing the risk of injury. D. Vibration, exposure to vibrations from tools or machinery, leading to hand-arm vibration syndrome and other health issues. E. Poor workstation design, improperly adjusted chairs, desks, monitors, and keyboards contributing to discomfort and musculoskeletal problems. 3. Ergonomic solutions and best practices. Workspace. Title: Workplace Safety Essentials, a student's guide to a safe and healthy work environment. Fifth topic. Introduction. Welcome to our educational YouTube video on workplace safety. In this comprehensive guide, we'll cover the fundamentals of workplace safety, including its importance, common hazards, prevention strategies, and practical tips for students entering the workforce. 1. Understanding workplace safety. Definition. Workplace safety refers to the measures and practices implemented to protect employees from hazards and ensure their well-being in the workplace. Importance: prevents injuries, accidents, and illnesses, enhances productivity, fosters a positive work culture, and promotes overall employee well-being. 2. Common workplace hazards. A. Physical hazards include slips, trips, falls, machinery accidents, and being struck by objects. B. Chemical hazards, exposure to hazardous chemicals, gases, fumes, and vapors. C. Biological hazards, risks associated with exposure to viruses, bacteria, fungi, and other pathogens. D. Ergonomic hazards, poor workstation design, repetitive motions, and improper lifting techniques leading to musculoskeletal disorders. E. Psychosocial hazards, stress, bullying, harassment, and workplace violence affecting mental health and well-being. 3. Prevention and control measures. Hazard identification, training students to recognize and assess potential hazards in the workplace. Risk assessment, evaluating the level of risk associated with identified hazards and implementing control measures. Engineering controls, designing workspaces, equipment, and processes to minimize or eliminate hazards. Administrative controls, establishing policies, procedures, and training programs to mitigate risks and promote safety. Personal protective equipment, PPE, proper selection, use, and maintenance of PPE such as gloves, goggles, helmets, and respiratory protection. 4. Emergency preparedness. Fire safety, understanding fire prevention measures, evacuation procedures, and the use of fire extinguishers. First aid, basic first aid training, including CPR, wound care, and responding to medical emergencies. Emergency response, familiarizing students with emergency response plans, alarm systems, and evacuation routes. 5. Legal and regulatory compliance. Overview of workplace safety laws, regulations, and standards aimed at protecting workers' health and safety. Understanding employer and employee responsibilities in maintaining a safe work environment and complying with regulatory requirements. 6. Promoting a culture of safety. Encouraging open communication about safety concerns and near misses. Recognizing and rewarding safe behavior and practices. Participating in safety committees, training sessions, and safety audits to continually improve workplace safety. 7. Resources for further learning. Links to reputable websites, articles, and organizations offering additional information on workplace safety and health. Encouragement for students to seek out internships, co-op programs, or volunteer opportunities to gain hands-on experience in workplace safety practices. Conclusion. By understanding the importance of workplace safety, recognizing common hazards, and implementing prevention strategies, students can contribute to creating safer and healthier work environments in their future careers. This video serves as a valuable resource for students to learn essential workplace safety principles and empower them to prioritize safety in all aspects of their professional lives. Together, we can foster a culture of safety and protect the well-being of workers across industries. Title: Nurturing Mental Health in the Workplace, a Guide for Students. Sixth topic: Introduction. Welcome to our educational YouTube video on mental health in the workplace. In this comprehensive guide, we'll explore the importance of mental health, common challenges faced in the workplace, practical strategies for maintaining well-being, and resources available for students entering the workforce. 1. Understanding mental health in the workplace. Definition: Mental health in the workplace refers to the emotional, psychological, and social well-being of employees as they navigate their work environment. Importance: promotes productivity, engagement, and job satisfaction while reducing absenteeism, turnover, and workplace conflicts. 2. Common challenges. A. Stress, pressure from workload, deadlines, and job demands leading to stress and burnout. B. Work-life balance, struggling to juggle work responsibilities with personal life commitments, resulting in fatigue and dissatisfaction. C. Bullying and harassment, negative interpersonal interactions, discrimination, and microaggressions affecting mental well-being. D. Stigma, fear of judgment or repercussions for disclosing mental health issues and seeking support. 3. Promoting mental health. Creating a supportive environment, fostering a culture of empathy, inclusivity, and open communication where employees feel comfortable discussing mental health concerns. Encouraging work-life balance, implementing flexible work arrangements, promoting self-care practices, and offering wellness programs and resources. Providing training and education, offering mental health awareness training, resilience workshops, and resources for stress management and coping skills. Destigmatizing mental health, raising awareness, challenging stereotypes, and promoting acceptance and understanding of mental health conditions. 4. Recognizing signs of mental health issues. Changes in behavior, withdrawal, irritability, mood swings, and decreased productivity. Physical symptoms, fatigue, headaches, digestive issues, and changes in appetite or sleep patterns. Emotional distress, anxiety, depression, feelings of hopelessness, and difficulty concentrating. 5. Seeking support and resources. Employee assistance programs, EAPS, confidential counseling services, crisis intervention, and referrals to mental health professionals. Mental health resources, online resources, helplines, support groups, and community organizations offering mental health support and information. Peer support networks, establishing peer support groups or buddy systems to provide mutual assistance and encouragement. 6. Legal and regulatory considerations. Overview of laws and regulations protecting employees' rights regarding mental health in the workplace, including anti-discrimination laws and accommodations for mental health conditions. 7. Self-care and well-being. Encouraging students to prioritize self-care practices, set boundaries, and seek help when needed. Emphasizing the importance of maintaining a healthy work-life balance and nurturing personal interests and relationships. Conclusion. By understanding the importance of mental health in the workplace, students can advocate for supportive environments, promote well-being, and contribute to creating healthier and more inclusive work cultures in their future careers. This video serves as a valuable resource for students to learn about mental health challenges, strategies for support, and resources available to them and their future colleagues. Together, we can foster workplaces that prioritize mental health and thrive on compassion and understanding. 7th topic, addressing the needs of underserved populations in the workplace, a student's perspective. Introduction. Welcome to our educational YouTube video on underserved populations in the workplace. In this comprehensive guide, we'll explore the challenges faced by marginalized groups, the importance of diversity and inclusion, strategies for creating equitable workplaces, and the role students can play in fostering positive change. 1. Understanding underserved populations. Definition. Underserved populations include individuals who face systemic barriers to equal opportunities and resources due to factors such as race, ethnicity, gender, sexual orientation, disability, socioeconomic status, and more. Examples: people of color, LGBTQ+ individuals, people with disabilities, immigrants, refugees, and individuals from low-income backgrounds. 2. Challenges faced by underserved populations. A. Discrimination and bias, experiencing prejudice, stereotypes, and microaggressions in hiring, promotions, and workplace interactions. B. Lack of representation, limited representation in leadership positions, decision-making processes, and company culture. C. Access barriers, facing barriers to career advancement, education, training, and professional development opportunities. D. Socioeconomic disparities, economic inequality, unequal access to resources, and disparities in pay, benefits, and job security. 3. Importance of diversity and inclusion. Benefits of diversity: enhances innovation, creativity, problem solving, and decision making by bringing together diverse perspectives and experiences. Inclusive workplaces, creating environments where all employees feel valued, respected, and empowered to contribute their unique talents and insights. Business case: improves employee morale, engagement, and retention, leading to greater productivity and profitability. 4. Strategies for creating equitable workplaces. Diversity recruitment and retention, implementing inclusive hiring practices, diverse candidate sourcing strategies, and mentorship programs. Training and education, providing diversity training, cultural competency workshops, and unconscious bias awareness programs for employees at all levels. Policies and practices, reviewing and updating policies related to equal opportunity, anti-discrimination, harassment, and accommodation. Support networks, establishing employee resource groups, affinity networks, and support systems for underserved populations. 5. Advocacy and allyship. Empowering students, encouraging students to advocate for diversity and inclusion in their future workplaces, challenge stereotypes, and promote equity. Allyship, building alliances and standing in solidarity with underserved communities, amplifying their voices, and advocating for change. 6. Resources and support. Providing information about organizations, non-profits, and initiatives focused on advancing diversity, equity, and inclusion in the workplace. Encouraging students to seek out internships, volunteer opportunities, or research projects related to diversity and inclusion. Conclusion. By understanding the challenges faced by underserved populations and promoting diversity and inclusion in the workplace, students can contribute to creating more equitable and inclusive work environments in their future careers. This video serves as a call to action for students to advocate for positive change, foster inclusive workplaces, and champion the rights and well-being of all individuals, regardless of background or identity. Together, we can work towards building a more just and equitable society for everyone. Certainly. Here's a brief overview of some key acts and regulations related to occupational health and safety in India and other countries. 1. India. A. The Factories Act, 1948, enacted to ensure the health, safety, and welfare of workers employed in factories. It covers aspects such as working conditions, safety precautions, health measures, and welfare facilities. B. The Mines Act, 1952, regulates working conditions and safety in mines, including provisions for ventilation, lighting, sanitation, and health examinations for mine workers. C. The Employees State Insurance Act, 1948, provides social security benefits to employees, including medical care, sickness benefits, maternity benefits, and disability benefits. D. The Building and Other Construction Workers, Regulation of Employment and Conditions of Service, Act, 1996, aims to regulate the employment and working conditions of construction workers, ensuring their health, safety, and welfare. E. The Occupational Safety, Health, and Working Conditions Code, 2020, intended to consolidate and amend laws relating to occupational safety, health, and working conditions of workers. 2. United States. A. Occupational Safety and Health Act, OSHA, 1970, establishes workplace safety standards and regulations enforced by the Occupational Safety and Health Administration, OSHA, to ensure safe and healthful working conditions. B. The Mine Safety and Health Act, MSHA, 1977, regulates safety and health standards in the mining industry, administered by the Mine Safety and Health Administration, MSHA. C. Americans with Disabilities Act, ADA, 1990, prohibits discrimination against individuals with disabilities in all areas of public life, including employment, ensuring equal opportunities and reasonable accommodations in the workplace. 3. United Kingdom. A. Health and Safety at Work etc. Act 1974, primary legislation for workplace health and safety in the UK, outlining employers' duties to ensure the health, safety, and welfare of employees. B. Management of Health and Safety at Work Regulations 1999, requires employers to assess and manage risks to employees' health and safety, including providing necessary training and information. C. Equality Act 2010, prohibits discrimination, harassment, and victimization in the workplace based on protected characteristics, including disability, race, gender, and age. 4. Canada. A. Canada Labor Code sets out the framework for workplace health and safety in federally regulated industries, outlining employers' responsibilities to ensure safe working conditions. B. Occupational Health and Safety Regulations details specific requirements for workplace safety, including hazard identification, risk assessment, and prevention measures. C. Human Rights Act prohibits discrimination in employment based on various grounds, including race, ethnicity, gender, and disability. These acts and regulations aim to protect workers' health, safety, and well-being, and ensure fair treatment and equal opportunities in the workplace. Compliance with these laws is essential for employers to create safe and inclusive work environments. We sincerely appreciate you taking the time to watch our content on Groups. Your support means the world to us, and we are thrilled to have you as part of our community. If you enjoyed what you saw, don't forget to hit that subscribe button. Subscribing ensures that you stay updated with our latest videos, updates, and exciting content. By subscribing, you become an integral part of our growing community, and your support inspires us to create more engaging and valuable content for you. Thank you for being a part of the Groups family. We look forward to bringing you more entertaining and informative content in the future. If you have any suggestions or topics you'd like us to cover, feel free to leave a comment below. Once again, thank you for your support, and we can't wait to share more exciting moments with you on Groups.